Imagine this. An elderly man visits the clinic and says, "Doctor, my hat size has increased." Sounds strange, right? But that unusual clue can point to a bone disease called Paget's disease of bone. Let's see why. Our bones are constantly breaking down and rebuilding. Normally, this process is balanced. But in Paget's disease, the bone remodeling process goes completely chaotic. The body keeps destroying and rebuilding bone too fast. First, osteoclasts break down too much bone. Then osteoblasts rush in to repair it. But the repair isn't organized. The result? A bone that is larger but weaker. Easy trick. Paget equals patchy giant bone. What clues might a patient have? Bigger hat size, bowed legs, bone pain, hearing loss. Remember, big bones, weak bones. Quick quiz. Why does hearing loss happen in Paget's disease? A. Ear infection. B. Cranial nerve compression. C. Muscle weakness. Think about it. On X-ray, Paget's disease has a classic appearance. Look for thickened bone, mixed lytic and sclerotic areas, cotton wool skull appearance. Memory trick? Cotton wool skull equals Paget's disease. Under the microscope, Paget's disease shows a very famous pattern. The bone looks like puzzle pieces joined together. This is called the mosaic pattern of bone, a favorite exam question. One more question. Which blood test is usually elevated in Paget's disease? A. Bilirubin, B. Troponin, C. Alkaline phosphatase. Got your answer? If the disease progresses, it can lead to fractures, high output cardiac failure, rarely osteosarcoma. That's why early diagnosis is important. Let's revise quickly. Increased hat size, bowed legs, mosaic pattern, increased ALP, hearing loss. One line to remember. Paget's disease creates large but weak bones.